Restraining and sedating someone during CPR? What in Thor's hammer in hell were you thinking? Why would you do such a thing? We'll talk about it on this One for the Road. We're getting better and better at doing effective, uninterrupted chest compressions on our cardiac arrest patients. With refinements in our techniques, with metronomes, with compression feedback devices, we're learning how to improve the patient's perfusion with external compressions. And we're also encountering more and more instances of something we refer to as CPR-induced consciousness. This occurs when an individual in cardiac arrest is able to have some moments of conscious recognition of the resuscitation team while they're in cardiac arrest. And if you haven't heard of this phenomenon, I can assure you that you're not prepared for it when it happens. And as the frequency of these events grows, I don't want you to be caught off guard if this ever happens during one of your resuscitations. I have personally had this occur twice over the course of my career, and it can be distressing for the responders, especially if you don't understand what's happening in those moments. CPR-induced consciousness can be broadly categorized into events that don't interfere with the resuscitation efforts and events that do interfere with resuscitation efforts. Not interfering consciousness, those events include purposeful eye-opening, looking at responders, and possibly vocalizing during compressions or procedures. Interfering consciousness involves breathing, head movement from the patient, and even physically grabbing at responders. If you didn't know that this was a thing, it is a thing. And there's a few things to think about if you encounter this situation. First, consciousness can also be a sign of return of spontaneous circulation. So it is worthwhile to stop CPR momentarily and check pulses. If the patient ceases consciousness when you stop compressions and there's no palpable pulse, you're likely dealing with CPR-induced consciousness. If the patient continues with episodes of consciousness that aren't interrupting your efforts, it's okay to verbally reassure them as well as reassure the resuscitation team. And if they are physically obstructing your efforts at CPR, consider either gently restraining them, kind of trying to restrain their movements, or if that's ineffective, some responders have even utilized sedation to effectively continue their resuscitation efforts. Now, the literature right now suggests that the most common sedative choices so far have been Versed or ketamine, and there are several EMS systems that have already included this in their protocols as an authorized use of those medications. But consider that those drugs can also lower blood pressure, so we definitely want to be cautious when we go down that road of medicating during CPR. Consider that with caution. As someone who has been through this, I want you to know that CPR-induced consciousness can occur, and it is being reported with increased frequency. And while it can be distressing to the resuscitation team, very few survivors have any memory of those episodes of consciousness. They don't typically recall it if the resuscitation effort is successful. But they are associated with positive patient outcomes. So we do need to keep working through these events. See them as a positive sign. Patient reassurance, gentle restraint, and even sedation might be required to minimize those interruptions in CPR. Don't be afraid to call your online medical control and consult with them if you're not sure of the best course of action. I hope you find that helpful if you ever encounter that situation. Thanks for watching. I'm Steve Whitehead, and that is One for the Road.